Now let's look at case 30. A 64-year-old man with a past history of smoking and well-controlled diabetes mellitus presents to the emergency department with a 3-day history of low-grade fevers, mild diarrhea, and non-productive cough. He works as a maintenance work in a local apartment complex. Workup includes a gram stain of sputum, which shows prominent polymorphonuclear leukocytes, but no microorganisms. X-ray of the chest reveals diffuse, patchy bilateral infiltrates. Relevant laboratory findings are as follows: hemoglobin 14 grams per milliliter, sodium 120 milliequivalents per liter, hematocrit 40%, chloride 100 milliequivalents per liter, platelets 200,000 per millimeters cubed, potassium 4.2 milliequivalents per liter, white blood cell count 15,000 per millimeters cubed, bicarbonate 17 milliequivalents per liter, blood urea nitrogen 16 milligrams per deciliter, glucose 110 milligrams per deciliter, creatinine 1.2 milligrams per deciliter, urinalysis 2 plus proteinuria, no glucose, ketones, or blood. What is the most likely diagnosis? Legionnaire's disease, an infection caused by the gram-negative rod Legionnaire pneumophila. Any patient presenting with diarrhea and pneumonia-like symptoms has Legionella until proven otherwise. This patient has evidence of interstitial or atypical pneumonia, which makes the diagnosis even more likely. What is the differential diagnosis for atypical pneumonia? The common differential diagnosis for atypical pneumonia is first and foremost viral infection, followed by chlamydia, mycoplasma, or Legionella infection. What test can help confirm the diagnosis? Urinary Legionella antigen test can establish the diagnosis. Legionella is unique in that it is the only form of community-acquired pneumonia that can be diagnosed with a urine test. What risk factors does the patient have for developing this condition? The patient's history of diabetes and smoking predisposes him to Legionella infection. Given his occupation as a maintenance man, he likely works with air conditioning systems. As this microorganism grows in infected water sources, the patient's occupation places him at risk. What are the appropriate treatments for this condition? Legionella responds best to antibiotics that can achieve a high intracellular concentration, such as macrolides, e.g. erythromycin, clarithromycin, and azithromycin, and tetracyclines. Legionella produces B-lactamase, so cephalosporins and penicillins are ineffective.